As the transgender refuge bill makes its way through the state legislature, so-called gender-affirming healthcare providers are anticipating an influx of out-of-state patients.
Sharon Hughes spoke to one provider to see how their clientele is changing.
Recently, the types of calls that come into Family Tree Clinic have changed a bit.
A very frantic mother calling for her trans child because she was like, yeah, this bill is about to go through and can we get in there?
That's how Xiomar Luna found out about Iowa's gender-affirming care ban for kids.
And then throughout the day, we got more and more and more and more phone calls. I think we maybe got like 5 or something that day. Some of them were even saying they're planning to move here, which I can't blame them, but they shouldn't have to uproot their lives just to be treated like a human being.
Family Tree Clinic in Minneapolis has been offering reproductive health care for 50 years and gender-affirming health care for 5.
Over the course of the last 5 years, we have moved from about 60% of our patients coming to Family Tree for reproductive health care needs and around 40% coming for gender-affirming care, and that has flipped. Gender-affirming care in terms of services looks like hormone care, and we provide services for pediatric patients and adolescents and adults.
Xiomar, who actually started as a patient at Family Tree, says gender-affirming care also includes receiving simple medical services while having their identity respected.
Being able to go to get like a pap smear as someone who is masculine or a trans man or whatever, and like have that still affirmed. Like, yes, you're a man getting a pap smear or getting an IUD.
And Dr. Kelsey Leonard-Smith, the clinic's interim medical director, says they're ready and have been ready to serve folks from both outside the metro and out of state.
We will figure it out. If we need to help you find a pharmacy that's right on the border, we can find you a pharmacy right on the border. We can find you a clinic that's, as close to your state as we can get, where you could get your labs drawn. And we can try to make this happen for you.
Many major medical associations, including the American Medical Association and the American Psychiatric Association, agree that gender-affirming care is clinically appropriate for children. But some medical experts have concerns about the long-term consequences of puberty blockers that may impact bone growth, fertility, and brain development. And it's important to note that research into this area is still very new.